Yes. Okay, sir. So as we mentioned before, the cancer cases are increasing globally in Myanmar too. So one of the most common cases are colorectal cancer. So could you please explain about how was it diagnosed and how can be treated? Yes.
Okay. So friends, as you rightly said,
yes.
So colon cancers, rectal cancers are increasing. Okay, and there are many risk factors.
Yes.
I think adopting a healthy lifestyle, eating lots of salad,
yes.
Avoiding processed foods
yes, sure.
is a way in which somehow you can prevent it.
Yes.
Okay.
Yes.
Now, as I told about pancreatic cancers, if I have to divide the colon or the large intestine, I would say colon cancers could be on the right side. Colon cancers could be on the left side, because colon is an organ which is present from the right side, center, and goes to the left side. Now friends, if somebody has a colon cancer of the left side, the most common symptom is that patients will have increasing constipation. So somebody who has had a normal bowel movement for many years suddenly now complains of increasing constipation. So this is something which you should not ignore. The second symptom for left-sided colon cancer is noticing blood in the stool.
Yes.
Right?
Yes.
So most often this blood in the stool is attributed to hemorrhoids or piles.
Yes.
So somebody who is, say, more than 50 years of age
yes.
should not neglect the symptom of bleeding per rectum.
Yes.
So bleeding and new onset constipation is a sign of left-sided colon cancers or rectal cancers. Patients who have right-sided tumors, yes. They will not have obstruction, they will not have constipation, they will have weakness, they will have fatigue, they will have palpitations. When you do a stool test for them, they can have small amount of blood coming in their stool. So they will not have constipation, they will not have frank bleeding, but they will complain of weakness and anemia. So those are the signs of right-sided colon cancers. Now, if I have to name one investigation that will pick up colon cancer or rectal cancer, it's a colonoscopy test. So colonoscopy, my friends, it's a test wherein you put a tube which has a camera on the top, inserted through the anal canal, goes through the rectum, examines your entire colon. If there is anything suspicious, a biopsy is taken yes. to confirm. Yes. Subsequently, the other tests that are done are a CT scan or a PET scan.
Yes. Yes. Okay, sir. So, sir, we have so many cases of the ulcerative colitis patient too. Could you please explain about what is the available treatment?
Okay. So, friends, before I start about ulcerative colitis, I would also like to talk about the treatment of colon cancer. Right? We talked about the signs and symptoms. We talked about investigations. The treatment of colorectal cancers depends upon the stage of disease, right? So there are various ways to treat colon cancer, and it is one of the better types of cancers in the body because these patients will have good prognosis, right? So if we have to do surgery, we do a laparoscopic surgery, because of which patients will have a very smooth recovery. If it is an early disease, a laparoscopic surgery is the complete treatment. It is sufficient for cure. For patients who have a locally advanced disease, we would give them, after surgery, we would give them additional cycles of chemotherapy, right? Now coming to ulcerative colitis, okay? So ulcerative colitis, friends, it's a non-cancerous disease which affects the large intestines, okay? Now the speciality of this disease is that it would affect only the rectum and the large intestines. It does not involve any other part of the body. So the inflammation in ulcerative colitis is limited only to the large intestines and the rectum, okay? Now the symptoms of these patients would be that they would have episodes of severe diarrhea. They will also complain of passing mucus and blood through the rectum. So patients will have exacerbations and they would have remissions. So during the remissions, patients are totally fine. They are having normal bowel movements, there are no symptoms. But when the patients have these exacerbations, they will have severe episodes of diarrhea, they'll have mucus and they'll have bleeding and they'll have weakness, okay? Now the diagnosis of ulcerative colitis is made by colonoscopy, okay? So you do colonoscopy. By visual inspection, you are able to identify the amount of disease involvement in the rectum and the colon. You can take a biopsy to confirm the diagnosis. Now coming to the treatment, okay?
Yes.
Now the most important thing to remember in ulcerative colitis is that one, it'll have exacerbations and remissions, as I said,
Yes.
and secondly, it's a pre-cancerous condition.
Yes.
So as the time passes, 10 years, 20 years, with every successive decade, the risk of cancer increases.
Yes.
And
Yes.
the cancers that form in ulcerative colitis are aggressive cancers, and they are multifocal cancers. So they can be present in multiple areas of the colon.
Yes.
Now the treatment of ulcerative colitis can be done by medicines,
Yes.
and it can be done by surgery. Now with medicines, it is basically more of a symptomatic care. So when somebody has these episodes of exacerbation, you give them medicines, anti-inflammatory medicines, steroid medicines, immunosuppressants that decrease the severity of the attack. Okay, so you give them these medicines, the patient gets better, patient is off medicine for some time, and then again when the patient has a relapse, you give them medicines again. Now for a patient who is having more frequent relapses,
Yes.
or if the patient's disease severity is very high, or if the disease is not responding to medical management, the best treatment is by surgery. Okay, so what we do in surgery is, because as we know the disease involves only the rectum and the colon, if we remove the entire colon and the rectum and we make a pouch using the small intestines and join it to the anal canal, it is the end of the disease. The disease just disappears, right?
Yes.
And you don't have to be on any treatment for it, you don't have to take any steroids, you don't have to take any immunosuppressants, and you don't have to be worried that you are going to get another relapse in the future.
Oh, okay, sir. Thank you, sir. Let me ask you one more question for the obesity patients. Could you please explain about the weight loss surgery?
Okay. Now, friends, we know that obesity is on the rise, and that is because of changes in our lifestyle. We are nowadays following sedentary lifestyle. We are not exercising. We are eating all fast foods, junk food, because of which the incidence of obesity is increasing. Now, I would say that obesity, it is a social issue. We would say that somebody who is thin, we would say thin is beautiful. Okay, which is not entirely true, but this is the common perception that people will have. So somebody who is fat, you are noticeable, so that's a social issue.
Yes.
If you are very fat, then when you go and buy clothes for yourself, you'll have to go to a different section, look for extra large sizes for yourself.
Yes.
If you are traveling, if you are on a flight and if you are in an economy class, you are uncomfortable, your co-passenger is uncomfortable because of your size. So that is the social aspect of it. But more importantly, obesity in itself is a disease, and it will bring other diseases as well. So somebody who is overweight or fat, there is a high chance that he is going to get diabetes earlier, his blood pressures are going to increase, there is increased incidence of depression, there is increased incidence of joint problems because you're putting so much weight on your joints that your joints give way. Patients who are fat, they will have breathing issues, they will snore at night, they will not get good sleep. Ladies can have menstrual disturbances, something known as polycystic ovarian diseases. There can be infertility issues, even cancers, rise in cancers like breast cancer, etc. They are increased in patients who are on the heavier side. Patients can get heart diseases, cholesterol problems, you name it, and it's associated with obesity. Now, the best way, if somebody is fat, the best way to control your obesity is by exercising and by diet. But when you cross a threshold, no matter how hard you try, just controlling your diet and just by exercising, you will not be able to lose sufficient weight to come into a normal category, and herein comes the role of bariatric surgery. Now, all these bariatric surgeries or weight loss surgeries, I would say there are lots and lots of different types of procedures that we do for weight loss, considering the situation of the patient. All these surgeries are laparoscopic surgeries. So the recovery again is very fast. Okay, so you are in the hospital for 2 days and then you are out of the hospital. When we do these surgeries, patients on an average would lose about 15 kilos of weight in the first month itself. the amount of weight that we want a patient to lose can be determined by the surgeon himself. So if there is a patient who is say 200 kilos and the target weight is 70 kilos, I can adjust my surgery so that he loses 130 kilos. On the other hand, if the patient is say 100 kilos and wants to come to 70 kilos, again I can adjust my surgery so that he loses only 30 kilos. So the patients will become thin, they will become smart, but more importantly, the diseases that come with obesity. So say somebody who has diabetes, who is on insulin, whose sugars are not getting controlled. We do the surgeries, the sugars normalize. The patients don't have to take insulin anymore. Patients are on blood pressure medications, hypertension. The blood pressure goes away. Now, I would also like to add that there would be a subset of patients who have bad diabetes. They are not very fat or they are moderately obese. We can even do surgeries to control diabetes in these patients. So when we do these surgeries, patients who are diabetics, their blood sugar levels will normalize. And as we know that diabetes is a disease that can affect all organs of the body, right? It can cause heart disease, it can affect your kidneys, it can affect your eyes, it can affect your nerves. So when we do these surgeries, the diabetes gets controlled and the patients then can lead a normal life. Okay?
Thank you, sir.
You're welcome.
Okay, so let me ask you to summarize today's discussion, and do you have any added suggestions or comments to the Myanmar patients?
Okay, so friends, to summarize, this is Dr. Professor Amit Javed. I am the director and head of Department of GI Surgery, GI Cancer Surgery, Bariatric Surgery and Advanced Laparoscopic Surgery at Fortis Hospital, Vasant, Kunj, New Delhi. Now in our department, we treat patients with all GI disorders, whether they are simple, whether they are very complex. We do surgeries for cancers of the GI tract, including food pipe cancers, stomach cancers, liver cancers, colorectal cancers, etc. We do non-cancer surgeries of the GI tract, including surgeries for acid reflux, hiatus hernia, ulcer disease, gallbladder stones, bile duct stones, choledochal cyst, chronic pancreatitis, acute pancreatitis, pancreatic cysts, intestinal obstructions, ulcerative colitis, Crohn's disease, diverticulosis, portal hypertension. So you name the disease and we have the surgical treatment available here with the best outcomes. Now the thing that differentiates us from other hospitals or other surgeons is that even the most difficult, most complex GI surgeries we would do with excellent outcomes and with the minimally invasive laparoscopic techniques. With these techniques, you will have a very fast recovery. Your outcomes will be very, very good. You will be able to go back home faster. The cosmesis will be very nice. We have one of the largest experiences in India for treating pancreatic cancers, pancreatic diseases, chronic pancreatitis, colorectal problems. Patients from across India, patients from across the world would come for their treatment here and they go back happy. So if you or any of your family members are suffering from any GI problems, please do contact and get in touch with us, and we will ensure that we will give you the best outcomes. Thank you.
Okay, so thank you so much for your time and sharing this valuable information to my patients.
Okay.
Yes.
You're most welcome. And I would say that any patients who are listening to our conversation, if you have any problems, whether you have cancer, whether it's a non-cancerous problem, which is related to your tummy, which is related to your abdomen, and you require surgery, I think you should definitely consider visiting us here, and definitely we would ensure that you would have one of the best outcomes possible concerned with your disease. Thank you.